low self-esteem presents in lots of reasons why people might come to therapy. You know, it often underpins or can be intertwined with things like anxiety, depression, disordered eating, body image issues, relationship problems, growing up in a dysfunctional family, childhood trauma. So there's just so many things that, you know, that it might be one of the ways in which those things it's showing up with, you know. And when we have low self-esteem, I think it's important to say it can really feel like our lives are not our own, like we have no control, you know, that life just comes at us, and that can be really frightening, like to have no agency. And I think that's why, you know, it is something that I see in practice. You know, people need therapy or they need support to sort of manage that lonely state. And also our self-esteem, it can be really knocked by life events. You know, as we've said, it's not set in stone. It's not like it's something we get as a kid and we're stuck with as is. You know, so I might see people in practice for things like they've lost their job, or they've become very ill, or they have had a breakup or divorce, or they're coming out of an abusive or controlling relationship. You know, these are all things that can negatively impact our self-esteem levels. Yeah. Yeah, so I suppose a component of low self-esteem is somewhere within a message that perhaps we have been told by others, or we tell ourselves eventually, that we don't matter, you know. And so being curious is a way to show that we matter, you know, trying to pay attention, you know, what's going on there, what happened there, you know, instead of kind of writing things off or just being like, oh, this is just because this is the way I am, you know, or not giving sort of attention. You know, curious, kindly curious attention is a really a useful tool in cultivating more self-compassion, but also improving our self-esteem. You know, it's essentially giving a shit about ourselves. You know, it's you know, it is, it's paying attention, you know, and we all want to feel like we're being paid attention to. And it is, I think many of our personal wounds that cause our low self-esteem, they were created in relationships, you know. So that with our parents, our siblings, friends, lovers. And because of this, we actually need a relational dynamic to help us sort of process and integrate and heal these things. And the relationship between a client and the therapist is really key to good therapy outcomes, but it can really teach a client a great deal about themselves, even though the relationship in therapy is professional and boundaried and structured. It can show us a lot about how we show up in all of our relationships. So it can be quite illuminating in that way, and that illumination is quite hard to get by ourselves. You know, we sometimes need the other, we need another person. And also, depending on the reason why someone might have low self-esteem, working with professionals can sometimes be about grief work, you know. So for many of us with self-esteem issues, there's something lacking, you know, or there might be a loss, there might be multiple losses. And so we have to grieve that. And that's a difficult thing to do alone. And it's a difficult thing to sort of unpick and define by ourselves. I also think that, you know, for people with quite a strong adapted self, you know, a kind of self that's a bit of a front or very for other people's benefits, you know, making time, you know, to come to therapy for 50 minutes a week, you know, and it does take time to build trust, but they can find a space where they can drop all that, you know, and they can learn what it's like to be themselves and how they can be themselves with another, you know. And I think that good therapy is a place where we can learn not to pretend, you know. And that's where the magic happens of really finding out who we are, what we're suffering with, what needs mended, what can't be mended, but also what we'd like, you know, what do we want our future to look like, what's important to us.